Hi, this is Dr. Tom Murtaugh of the Christ Hospital in Cincinnati, Ohio, on behalf of the International Cardio-Oncology Society. Today we present highlights from a recent webinar discussing the prediction of bleeding complications from the treatment of venous thromboembolism in cancer patients. Our presenter today is Dr. Isabella Mahe of Paris, France. We also invite you to attend the Global Cardio-Oncology Summit. This year will be held October 5th through the 7th, 2026 in Williamsburg, Virginia, in the United States. This is the premier global meeting for cardio-oncology, and I know you'll find it interesting. So without further delay, here's today's presentation.
We can see that the prognosis has been improving and the life expectancy increasing thanks to progress and major advances of diagnosis and therapeutic strategies. So consequently, most patients undergoing VTE in the context of cancer are still alive 6 months after VTE occurrence. So we have two questions. How should we be treating those patients at the diagnosis? And then how long should we be treating them and how should we be treating them? It is a new question we are as clinicians facing in our very everyday practice with our patients. And the results of the APICAT studies were expected a lot to have answered for our practice. So with the reduced dose, we are very reassured with the efficacy issue. But so as a consequence, our main concern for clinical practice remains now the risk of clinically relevant bleeding. Here you have in detail the risk of clinically relevant bleeding, which is a composite of major and clinically relevant non-major bleeding. And of note, you can appreciate on this slide that with a reduced dose, you not only reduce the risk of clinically relevant bleeding, but also the risk of major bleeding. And this reduction appears as soon as the reduced dose is proposed to patients. So it's very important for practice to move now, to change our practice, and after 6 months of treatment, to move to the reduced dose. So in conclusion, in this analysis, we identify 4 clinical predictors significantly associated with increased risk of clinically relevant bleeding during extended anticoagulant in CAT patients, anemia and or thrombocytopenia at occlusion, age of 75 or more, PE as index event, and male sex. 3 of these factors are statistically significant predictors of major bleeding, and association were broadly consistent across cancer types. There is no evidence of interaction with apixaban dose, and overall this analysis reinforces the clinical relevance of the APICAT findings, including patients who are non-modifiable bleeding risk factors. Thank you.
Thank you so much, Isabel. That was really fantastic. And that study, obviously, we talked about the main findings of the study last year, and I think it's a super important study and certainly practice changing. How do you see this post-hoc analysis fitting into that space? I mean, do you think that it has changed what you would normally do, or did it refine what you would normally do based on what you just presented?
Thank you for the question. So and before this analysis, we didn't know at all what we would find. So we identified predictors of bleeding for the first period, for the first 6 months of treatment. And as you know, in the different studies with different DOACs, some cancer-related factors emerged, such as the site of cancer, of course, but also the metastatic stage or the unresected tumor. And we were quite surprised that not the same factors emerged as predictors for extended treatment compared for the first 6 months. And those predictors are not modifiable. So our first idea was to try to identify factors that we could correct or act on. And so here with the factors we identified, they are not modifiable. And the point is that even with such predictors, the reduced dose performs better than full dose. So finally, our conclusion is that the low dose should be provided every time we can, even in a case of risk of bleeding.
Thank you to Dr. Mahe for that excellent presentation on an important and evolving topic. Don't forget to make plans to attend the CHICO Summit in 2026, October 5th through the 7th in Williamsburg, Virginia, in the United States. This is the premier meeting for cardio-oncologists worldwide, and I know you will enjoy the presentations there. Until then, this is Dr. Tom Murtaugh reminding you to treat cancer, protect hearts.